One of the misconceptions that a lot of people have about human trafficking is that it's not happening in their communities, and truly it is. For each one of those individuals, this is a crisis situation. They need help now.
Before we relaunched the Human Trafficking Initiative, there was nowhere victims and survivors of human trafficking could really access health care. Somewhere where the team of providers and the staff understood their unique trauma needs.
Anyone who knows me will say that I'm extremely sensitive. I have a really big heart for everything, for everyone. I think that it's made me very vulnerable in certain situations. When I turned 13, I ran away from home. And when I did, I was around some bad friends, people I shouldn't have been around, and I ended up getting kidnapped. I was trafficked from Sacramento to Phoenix, Arizona. I ended up being rescued in Vegas. I still don't know how long I was gone. It all just kind of became a blur for me. I didn't talk about my experiences. It was just over with. Going into a doctor's office, you can't let them know what you've gone through without feeling like you're going to be judged or they're going to call the police on you or something bad is going to happen.
We're able to create access that they never had in the past. And we're able to do it using trauma-informed techniques and practices and survivor-informed techniques and victim-centered care so that we don't re-traumatize patients. The program also concurrently trains the future physicians to be able to identify, respond to, and appropriately care for survivors of human trafficking. When we first started implementing this care, I was very naive to the community agencies that already existed in our area. And what was incredible is when we created the Medical Safe Haven, we immediately had all of these agencies that were very excited about having access to us. And then this collaboration, this networking just kind of developed.
City of Refuge is a community-based organization, and about 9 years ago, we had 17 girls that showed up in our lives that needed off the streets, and all of them had one thing in common: they were being trafficked. The work that this clinic has done in providing health services for our victims when it comes to physical health or mental health has been absolutely life-changing for our program and for the women we serve.
Now, I'm a program manager at Community Against Sexual Harm, TASH. We work very closely with the Medical Safe Haven. My first experience with the Medical Safe Haven absolutely floored me. My first client I brought there did not have any medical insurance, and she didn't have an ID. And they brought her in and talked with her and met with her and made sure all of her needs were met. The compassion and openness and the willingness to deal with my clients, I had just never experienced that. I mean, I went back to the office almost crying. It is so important that the Medical Safe Haven is there because it's not only dealing with the victim, but also their children and breaking those cycles. If I would have received care like this from the Medical Safe Haven, my life probably would have turned out differently.
We're replicating in 2 locations right now. As we're in those committees, we have just now spread the trauma-informed care for survivors that much further. And each one of those residencies has graduating physicians who will take this care beyond our clinic walls.
It's not like we've solved this issue. I mean, so far from that. We've created part of a solution that I think we need to replicate, and we need to do it quick. If we could do this throughout all the programs in Dignity Health and then replicate this at all the primary care programs across the country, I mean, we've just changed access to care for this patient population.
I'm incredibly proud of Dr. Chambers for championing this and for Dignity Health putting behind it the resources it needed. The generosity of the foundation means that every call we get in our clinic, we've never had to say no to a patient for healthcare, for transportation, for labs.
The quicker we do it, the more lives we save. It's huge.
There are victims and survivors who are waiting for this type of care.